Good morning. This is the Anchorage Emergency Operations Center's operational update for May 17th. Okay, we're sharing some photos of this weekend's Sleeves Up for Summer, some of the 12 to 15-year-olds that got their shots this weekend. And situation overview. Go ahead, Luke.
Good morning. Today is day 439 of our response, and locally, up 41 cases, 0 deaths, and 4. In our congregate shelters, we have 408 clients, down 7 since the last report. In the non-congregate shelters, 321 clients, up 6. It's a total of 729 clients in all shelters, down 1, averaging 2,187 meals served per day. Over the weekend at the Visit Healthcare testing sites, there were 714 sample collections performed. And yesterday at our active vaccination pods, 329 doses. End report.
Copy that. Thank you, Luke.
Yeah, good morning, everyone. It's Michael Cutts out with the National Weather Service office at Sand Lake. Generally looking at mostly sunny days with a bit more cloudiness added in towards midweek, and the heavy cloudiness moving in for the second half of the week with chances of rain through the end of the week. A little breezy along Turnagain Arm, but otherwise fairly close seasonal temperatures. And that concludes my briefing. Are there any questions?
Thank you, Weather. Operations.
Good morning, everybody. Pat Ryder, Deputy Operations Section Chief. Today with Mass Care, our Q&I location has 13 projected discharges through Wednesday, to include 3 discharges today. Our Q&I location at the guest house has now begun sheltering vaccinated clients per CDC guidance. With public health, Visit Healthcare testing had a decrease of 12.53% over the previous week's sample collections. As of May 13th, our 7-day rolling positivity rate average is 0.93%. Our 14-day average reproductive rate is 0.851. And our 14-day average case rate is 8.97 for every 100,000 people in the population. We officially dropped into the intermediate alert level. Beginning today, Elmore testing site hours will now be from 10 a.m. to 6 p.m. And we are now offering testing available on Sundays at the Lusac Library. That'll be from 10 a.m. to 4 p.m. With medical countermeasures, Visit Healthcare is now offering multiple vaccine types at all 5 of our vaccine clinics. We are also reaching out to youth organizations, summer camps, and sports leagues to offer mobile clinic vaccinations for those 12 and above. And finally, just a reminder, our mobile vaccine clinics can come to wherever you are, be it church, organization, or other business. To schedule, please dial 907-531-5100. Those operations, barring any questions, and report.
All right, no questions. Thank you. Logistics.
Hey, good morning. It's Scott Carpenter, your Logistics Section Chief at the EOC. Here's our continuing lines of effort for the week. For Mass Care, we continue to demobilize the Fairview Rec Center and get it ready to return to Parks and Recreation, as well as continued support for the persons experiencing homelessness through shelters and wraparound services. Under medical countermeasures, we continue to support Vaccination Week number 2, as well as the June vaccination sites. In other support, we continue to work staffing requests, both new and extensions of current personnel, as well as working support issues for the operational transition to AHD and development services. Pending any questions, that's logistics.
Thank you, Scott. Finance.
Good morning. This is Carrie Wiedeker, current EOC Finance Section Chief reporting. Today, we would like to welcome back into the fold Audrey Jo Malone, who is joining us today, and we will be transitioning over the next week or two. Currently, the EOC has encumbered $19,442,601. Our current spent to date is $51,323,229 for a total of $70,765,831. Continue sending invoices and supporting documentation to eocinvoices@anchorageak.gov. The Office of Emergency Management does continue to seek cost recovery by way of FEMA public assistance. For information related to that, please contact Erin Zachary. End of report.
Thank you, ma'am. Safety.
Good morning. This is Annalisa Roberts reporting out for safety. As many of you are aware, the Anchorage Assembly revoked the city's mask mandate on Friday, and now it's advisory. So what that means is people who are fully vaccinated can safely interact and get back to the activities they did prior to the pandemic without wearing a mask. And while this is good news, we still need to practice caution. So if you have been fully vaccinated and you've been in contact with somebody who is COVID positive and you're experiencing symptoms, get evaluated by your healthcare provider and follow the direction on whether you should be getting tested. And individuals who are unvaccinated should continue testing if they've been in close contact with someone confirmed with COVID and they're experiencing symptoms. We still need to practice social distancing when appropriate and washing our hands and trying to not use shared utensils, just so we can continue slowing the spread of this and get back to a new normal. End report.
Thank you, Saki. Public information.
Good morning, everyone. This is freshly minted lead public information officer, Heather Arono. Cale Casey has been our lead PIO since January, and he has been very helpful in making transition. He's going to stay with the team until fire season calls him away, but just want to let everybody know about the transition change. I think we've got everybody's email addresses and everything switched over. Wanted to just let you know we're continuing messaging about the 12 to 15-year-olds being added into the vaccination pool. You saw some photos on an earlier slide of some of the kids out there getting vaccinated. There was a lot of enthusiasm, lots of questions from parents just wanting to know a little bit more information. So we're doing our best to keep everybody informed. Sharing flyers and translations about translated flyers about vaccines and testing appointments with community leaders and key influencers. Just trying to make sure that information is as accessible as possible to our community. And just a quick note, last week you saw some photos of Grover, who you'll see on the slide over here from an earlier event. He is a dog that works with the crisis response dogs. And we had a parent reach out. She has a 12-year-old daughter who is very afraid of needles. And Grover is going to make a special appearance at her appointment so that everybody can make it through with hopefully as little stress as possible. But just wanted to let you know that that was something that we were working on. She'll get her vaccination on Friday. Other than that, just doing what we can to help make sure information is available to the community. If you have any questions, need anything, have any great ideas for where we should be paying attention to, please don't hesitate to reach out. Barring questions, end of report.
Thank you.
Good morning. This is Celeste Prescott, liaison for the EOC. I'd like to thank all of our partners that were able to join us today. And I have a couple that have report outs. Let's start with Jim Baldwin, Food Bank of Alaska.
Good morning, everyone. Jim Baldwin, Food Bank of Alaska. Just a reminder that Thursday, May 27th, will be our last emergency food distribution at the Tecate Commons. Over the last several weeks, we have been distributing flyers to everyone receiving those emergency food boxes, letting them know where they'll be able to receive future assistance. After the 27th of May, we're trying to get folks back connected with our community pantries and partners to continue to receive services. End of report.
Thank you very much for all you're doing out there, Jim. And I know Tracy is on with Matsu EOC. Go ahead.
Hi, this is Tracy with the Matsu Borough EOC. Friday's Talkeetna and Wasilla clinics went well. Talkeetna's filled all available appointments, and Wasilla saw a significant number of the 12 to 15 group. This week we'll be at supporting public health nursing with the vaccination clinic at the Friday Fling in Palmer. Thank you. End of report.
That's great news, Tracy. Thank you. And I believe, is Kristen on with Alaska Native Medical Center?
Good morning. This is Kirsten with ANMC. Today we have 2 COVID positives inpatient. Neither are in the CCU or on ventilators, and 0 PUIs. End of report.
Thank you, Kirsten. And Sean with Alaska Regional Hospital, go ahead.
Good morning. Alaska Regional Hospital currently has 4 COVID positive patients, 1 in the ICU, no vents, and no PUI.
Great news. Thanks, Sean. Nikki, are you on with Providence Alaska Medical Center?
Yes, I am. Good morning. At PAMC today, we have 5 COVID positive, 2 in ICU, 1 on mechanical ventilation, and 1 COVID recovered. Thank you.
Thank you, Nikki. And Matsu Regional Hospital was not able to join us, but they're reporting out 5 positive cases, 2 in the ICU, none on ventilators, and no PUIs. And is anyone on for 673rd Medical Group? Sounds like they were unable to join us this morning, and so that'll be all for Liaison. Thank you.
Thank you, ma'am. Health.
Hey there, this is Kelly Biostock with Anchorage Health Department. The overall COVID-19 risk level has dropped to the low end of the considerable risk category. Our average daily new case counts have decreased below 10 cases per day per 100,000 residents, moving us to the considerable risk level for that metric. With just over 50% of the eligible residents completed their vaccine series, we now have 2 subpopulations with very different COVID-19 risk profiles. One is unvaccinated individuals. They continue to fall in the high risk category, while vaccinated individuals are in the lower risk category. So according to the CDC, people who are not vaccinated should absolutely wear a mask when indoors and with people you do not live with. And in addition, in large crowded outdoor events. Masks are also required for all travelers while on public transportation, including buses, trains, and planes, and people must also wear masks while at transportation hubs, including airports and bus terminals. So with fewer mandated restrictions, individuals, especially the unvaccinated individuals, need to assess their own risk and regulate the activities accordingly. That is it from the health department this morning. Thank you.
Thank you, ma'am. Command?
Good afternoon. This is Instant Command, or good morning, I should say. This is Instant Commander Bob Dole. On Saturday afternoon, I met with about 30 senior citizens in Mountain View, all of who are living independently. And what was really kind of, to me, inspiring about this group is 100% had been vaccinated. This is just regardless of where they came from or just how they got there, all 100% would be. And it just shows with a kind of focus and unity of effort, we can get there. It was a celebration that is normally done every year with this group. Last year, they couldn't meet. It was great that with the progress you all have made as a team and we have made as a team, that they were able to gather and repeat outdoors at still a safe distance this annual event. Thank you all for all you're doing.